So we discussed previously the hips and pelvis being that first centre of rotation when we're throwing the punch. The next area that we want to focus on is our upper back. So as we throw the punch, our upper back is rotating towards the opponent. Upper back rotation tends to be particularly stiff in a lot of fighters, and there's a number of interventions that we can incorporate to try and maximise the range of motion in this area.
Unilateral thoracic extension, mobilisation with the use of a ball, basically placing it to the side of the spinous process so it's close to the articular pillar, so that as we arch back, we're getting that extension in combination with rotation. Placing the ball between the spinous process and the medial border of the scapula, and with the ball in place, bringing the arm diagonally across the body. We can perform large diagonal movements, or we can perform smaller movements just at the end of range. The position where we can perform an active thoracic rotation is in side lying using a foam roller. So if we're rotating towards the right, we would lie on the right side with the right hip flexed up just past 90 degrees. And then to try and facilitate that rotation, we would have the left hand pointing directly up towards the roof and can perform a rotation again using a diagonal movement of the shoulder. Or we can also perform a rib grab technique where we're actually using the right hand to pull on the left side of the ribs and actively apply a rotation through the upper back. So we can also address thoracic rotation range of movement with the use of some resisted thoracic rotations. This can be done in a number of different ways. We can start just by performing resisted thoracic rotation with the use of the TheraBand. We can also do some isometric holds at end range, so basically moving the body into end range thoracic rotation and then applying some resistance, holding that contraction there, taking away the resistance, and then attempting to move further into range.